Welcome to another episode of Taking Control of Cancer, the podcast brought to you by the North East London Cancer Alliance. And I'm here at Goodman's Field medical practice in Whitechapel, where they're holding a special World Prostate Cancer Day men's health event, talking to men about prostate cancer, but also issues like drinking, like weight, like general health. They're doing blood tests in front of me. An awful lot going on, probably about 20 or 30 men in the room finding out everything you need to know. Actually, this is a hepatitis C test going on in front of me that some chaps are just going through now. Really amazing event. And we're going to talk to Toby, who is one of the GPs here in our first episode. And then Rishi from the North East London Cancer Alliance, and Boomy, who's one of the GPs here in North East London, more specifically about prostate cancer. So yeah, that's where we are today. Goodman's Field Health Centre. Really fantastic event, and we'll tell you a bit more about them in the following episodes.
Hi, so I'm Toby. I'm a GP here at Goodman's Fields. We're in East London, in Whitechapel, and today we're hosting an event that's our men's health event, focused quite a significant amount on prostate cancer, on awareness of prostate cancer, what things people should watch out for, and really trying to promote that men should come forward when they have symptoms or worries to talk to us so that we don't leave things too late and that things are picked up earlier.
Just tell me first a little bit about your work here, and specifically, the area that we're in, what kind of challenges you guys face here.
Yeah, so I work as both a GP here, but I'm also a Health Inequalities Lead for our organisation, Operose Health, which looks after GP practices across the country, and I'm a Health Inequalities Lead in Tower Hamlets and Hackney, so in parts of North East London. A lot of my job in terms of our local population is making sure that we have equality in our access, which basically means, in simple terms, making sure that everyone, regardless of your background, your language spoken, where you're from, your cultural beliefs, if you're male, female, that you have the same access to healthcare as anyone else would. We try to find where there are challenges there and try to address those challenges in order to make our care better and to make sure that everyone gets the care they deserve from the NHS.
You've obviously focused a bit of your time specifically on cancer awareness, early diagnosis. What took you down that kind of route?
I think it's something that we see as GPs every day, right? The old age tale is the GP cares for you from cradle to grave, from the baby that's born on their first day that comes and sees me to your last days. We look after everyone. And that means that we see a lot of cancer as well. We see lots of cancers that present early, but I think as GPs, and as I've progressed through my early career journey, we see cancers which present late. And it was those things that made me think more about how we can address and try to build on our care of patients who potentially present slightly later with cancer diagnoses, whether or not we could have picked them earlier. We've done some work in screening. Obviously, there are national cancer screening programs within the UK. The idea being that these are ways we can pick up cancers before you even have symptoms. But then with those with symptoms, we need to make sure that people know the signs so that they can come and chat to us.
We've talked a load of times on this podcast about you guys being the first port of call for people, and in so many cases, it's worth just kind of re-emphasising the importance of you guys, the importance of coming to see you guys whenever anybody, not just men, we're talking specifically men today, but whenever anybody has anything they're concerned about.
Yeah, I think the biggest thing for me when it comes to cancer and worry of cancer and those discussions with your GP is that as soon as you walk in the door, I want to know what you're worried about. I think that changes the consultation for you and for me as your doctor, in that it means we can address those concerns head on. There's a lot of cases in which cancer is something that's often in the back of your mind. There's a lump that's come up that's unusual. Your weight is lower than it is previously and you're not exercising, or something isn't right. And naturally, lots of people worry about cancer. They may have a friend or family member, someone they know close to them who's experienced something. And that worry sits in the back of your mind. And in GP, sometimes people will come to me and I'll find that after us talking through your symptoms, how things have been recently, what tests we might do, at the end, I get there, but doctor, what if it's cancer? And as doctors, we could probably be better at that, in that often we're thinking about cancer, but we're probably not saying it. My advice for anyone when we're talking about concerns of cancer, if that's something that you're worried about, is if you bring it up in the first minute, then that's what we're going to be talking about. That's what we're going to be excluding, or that's what we're going to be testing for.
If we're talking about men specifically, then what are some of the things that maybe prevent men from coming forward? Because somebody said to me in an earlier episode, they said that quite often with men, when they get a cancer diagnosis, it's not a surprise because there's often something that has been niggling, something that they've been worried about, a lump, a bump, unexplained bleeding, all the things we talk about. What are some of the challenges and the things that prevent men from coming to see you early, do you think?
I think there's loads of reasons why men don't come to see us, and that's why we're talking today. It's why we're having men's health events. It's why we're trying to talk more openly to all men, half of our population, about presenting with something unusual sooner. Things that put people off. Fear. Lots of men fear that the lump that they find is definitely cancer, and so there's no point going to get checked out until something's drastically wrong. There's that fear that then evolves into, well, what if this is cancer? How am I going to provide for my family? How am I going to work my job? How am I going to break this news to people that are my loved ones? The other things that hold people from coming to us, lots of people tell me they don't want to bother me. Lots of people tell me
You'd be a very
they
quiet
thought
man
it was...
if nobody bothered you.
Exactly.
You'd have a very easy job.
And lots of people tell me that they thought it would just get better,
right,
and that it might go away. And then they only come to me far, far later than I'd want them to, saying, oh, well, it didn't go away now. I think to all men in those settings, in those reasons why they might not come to us, the key thing has to be, if something's wrong, your GP wants to see you. If you're worried about cancer, your GP wants to see you. In the world of GP appointments now being largely given by doing online forms or making requests to your doctors where you get to actually type a little more about what's concerning you, what's worrying you, put that straight away. Tell me that you're worried about cancer. If anything, it will mean that that's the focus of our consultations, but also it means that things are not being put off. We hate to see when people have come multiple times about minor issues that they feel maybe are not related, and then tell me 6 months later, after we've built up that rapport together, I've actually got a lump that I haven't told anyone about. And those are useful moments for us because obviously we've been able to build that rapport with people, but that concern's been there for a long time, like you say.
I imagine it's fine for some men, they will be thinking cancer. Some men are very educated in this kind of area. They know the symptoms, they know what to look out for. Plenty don't as well. Particularly some of the, the more rare cancers maybe that have more, slightly niche symptoms, perhaps some symptoms that masquerade as other things or could more commonly be other things. How do we educate men who maybe, I'm really generalising here, but maybe don't engage with this kind of education as well or as much as females possibly?
Yeah. I think this is really hard. I think stuff like this is important. Having there being resources that are supportive, that are providing education, having men's health events in our GPs. But I think the other thing is just getting messages out there via our GPs, via our social media, via podcasts, things like this, that genuinely, it doesn't matter why you're coming to the GP, and it doesn't matter if it's anything to do with cancer. If something's wrong, I genuinely want to know about it. Like you're saying, I wouldn't be very busy if people didn't come to me and they were worried. But I could be much busier Because there's lots of men sat at home who are worried about something, but they're not coming to their GP. They're putting it off. They're thinking, oh, it's not worth it. I would say that worry is my strongest factor. And if there's any worry of any symptom you have, you don't need to know that that symptom could be cancer. You don't need to know that that symptom could be an infection or something that needs a diagnosis. Genuinely, worry is what drives us to look after people well. If I can address your worries, then we can provide you good care.
So you don't really need the patient to know the difference between, what could or couldn't be cancer, what could or couldn't be serious.
Not at all.
Any concerns, you're the guys with the training and the expertise.
I think that's the biggest thing, right? We have to acknowledge that I don't need my patients to be doctors. I need my patients to care about their own health. And if you care about your own health and you're worried about your own health, it's my job to figure out why.
Are there any particular cancers? We've talked in previous episodes about this part of London being perhaps not unique, but lots of challenges around diversity, health inequalities. Are there any particular cancers that you see more of and more of at a later stage as well?
So I think, we see all different types of cancers here. As your GP, we see everything. One of the things that concerns me most is thinking about cancers which present late, as you're saying. One of the key things that we want to focus on locally is thinking about our presentations of bowel cancer. There's a bowel cancer screening program. So now any man or woman over the age of 50 will be invited for a bowel screening kit. A simple test that you collect a poo sample at home, put it back in the post, and we find out whether there's anything to worry about. Again, it's going back to that worry.
Yeah.
If we diagnose people early with bowel cancer, there's a 90% chance that those patients will have good survival after 5 years. If we catch bowel cancer late, at stage 4 when it's spread, these are patients who turn up to me with symptoms normally. This survival rate drops to 10%. And that's the change that we want to see by making sure people are engaging with screening. I think bowel cancer is one of the biggest things that I'm focused on at the moment.
So talk me through the process of somebody coming to see you with a initial concern, maybe something, it's been niggling for a few weeks, maybe it is blood in the poo or something like that, or a lump that's unexplained. What's the kind of process? What's going to happen?
Yeah.
Typically, I know each case is different, but what might be the timeline, the kind of what might they be facing in terms of what they're going to go through over the next weeks or months?
Exactly. This is the key of how GP is the open front door to your health. You have a worry of some unusual symptom. As we said, what if you have blood in your poo? You come to see me, we have a chat. That's always the first part of finding out what's wrong. In medicine, we call this taking a history, which I think is quite a good word because it's essentially just the history of you. It's us finding out what's going on and what's happened in the past and what's happening at the moment. That chat can be a few minutes. But in that few minutes, your GP is working to figure out, how worried am I? Does this patient need extra tests? Following that chat, most GP consultations will have some sort of examination. This could be something as simple as feeling your tummy, but sometimes can involve more personal examinations. Someone has bleeding or a lump in a private area. This might need to be examined by your GP. I guess what I'd say to people is that if there is something that is in an area that you wouldn't want to be examined, think about this when you're booking your appointments. If you'd prefer, as a man, to be examined by a male GP, ask your GP if that's an option. I have lots of men come to me who would prefer to see a male GP because they've got a lump on their testicle, and that actually they were putting it off for a while because they weren't sure that they wanted someone else who wasn't a man to examine them. These things you can ask your GP for. In emergency settings, they're things that we struggle to accommodate. But most GPs will be really good at saying, well, yeah, if you come on a Thursday, we'll sort out and we'll get one of the male GPs to see you and examine you. If those are your concerns, and we see this as concerns from all cultural backgrounds, that's something that we need to make sure that you can highlight to us and we'll address. Some form of examination, and then often some tests. Most suspicious things for cancer probably start with some blood tests. Other specific cancer symptoms will come with their own specific tests. If you've got bleeding in your poo, I might want to test your poo. If you've got a lump, I might want to get a scan of that lump. But ultimately, if your GP ends up being really concerned that what you're presenting with might be cancer, the GPs will have access to what's called 2-week wait or urgent suspected cancer referrals. This, in the realms of the NHS existing as it is at the moment, is what I love to say to patients, is the one bit of the NHS that definitely still works really quickly. People worry. I'm worried about cancer, doctor. I've got a lump. Am I going to have to wait 9 months for an appointment? And the answer, if your doctor is also worried about cancer, is definitely not. The way that these referrals work is that the hospital will be in touch with you within the next 2 weeks with an appointment. And this means that you'll get further testing, a specialist review, and all that happens within the first month of you going to see your doctor. That's the goal, is to try to get these earlier diagnoses so that we can find cancers if they do exist and treat them sooner when they're easier to treat.
The embarrassment thing is an interesting one, isn't it, I think, because I'm sure that we can all identify with, the feeling of not wanting a stranger poking and prodding us in a area that we don't normally show to strangers.
Of course.
But when you really break down that embarrassment, it's 5 minutes of embarrassment in inverted commas against the benefit of finding something that could save or change your life.
Exactly.
It's an interesting one to try and explain, but one that's completely understandable.
I think 100% understandable. One thing I like to reassure patients as well, which I guess is reassuring to some but difficult for others, is actually there's probably nothing that your GP hasn't seen. Something feels embarrassing, something's a lump that you don't want to show them, something is bleeding, something looks unusual. I promise you we've probably seen something worse. And what that means is, in that setting, all I'm doing is checking to see how worried I am. I talk a lot about worry, in that I want patients to come to me when they're worried, but actually lots of medicine is just passing worry until we have answers. You pass me your worry, if I'm worried I pass the hospital worry, until we have answers, and that's how we make sure that we're looking after people.
But worry's not a black and white thing. You're not worried or worried. The different levels of worry, aren't there? Because I know you guys have a really tricky job in a sense in sort of being the gatekeeper to the rest of the system, the rest of the pathway. And we've all heard cases. We've spoken to people. I've spoken to loads of people who've been seen by GPs numerous times and been sent away, and it's eventually ended up being cancer. And that's, there was a chap I spoke to a long time ago who had a really rare type of cancer that the only symptom he presented with was a weepy eye, or like a weepy tear duct. And I think as a GP that must be so difficult, because you're going to miss things, aren't you? There are going to be things, you can't just you take everybody and pass them on to the next stage. You've got to have some degree of assessment, and there are going to be things that you're going to miss, and that's the challenge that you guys have, I guess, of it isn't just about being incredibly well educated on all the symptoms of all the cancers. I mean, that might be impossible to be across everything like that, but it's a tricky balance, tricky job for you guys.
I think so. But those cases are really hard. Patients who have presented again and again and end up having something life-changing, those cases are really hard. The key thing that I would advise, and that reassures me in my work, is I need patients to know that if something's not getting better or something's not right, that they come back. If you want a second opinion, you're entitled to second opinions on the NHS. Ask to see a different GP. Ask to see someone else. If your symptoms don't get better, then the answers that you've been given aren't reassuring enough. These things the NHS will never judge you for. Your GP practice will never judge you for coming back. I hear this from patients as well, is, well, why would I come back? Last time you told me it was fine. The answer is because it's no longer fine. If it's carrying on, then we need to know about it. A good example is things like a cough. If you have a cough and you come to see me, I say, this is probably just a virus. You're going to get better. I've examined you and checked things. But that's because you came at week 1. The difference between that and someone who might present with something a bit more worrying is when you come back 4 weeks later and you still have a cough. And it's not got better, it's got worse. Those are the patients that we then worry a bit more as their GP about, well, could this be something like cancer? And I think with all symptoms, we could do a podcast and spend the entire day, right, talking about every symptom of every cancer. Yeah. But I think with all symptoms, the question has to be, has this gotten better in the time I would expect it to? So if you have a cough, it might last a week or 2. If you have a cough more than 3 weeks, it's a bit more unusual.
And there's an onus on us as the patients to understand our own bodies too, isn't there? And understand, what's changing and what's not, and be aware of changes.
And I think, those are difficult because as life goes on, our bodies change, right? We need to know that our weight fluctuates throughout time, but if you have weight loss that you weren't expecting, you've not been at the gym, you've not changed your diet, those are the things that start to make us worry a little bit about cancer. As you said, lots of things are really rare or unusual or present unusually. In the background mind of most doctors are the symptoms of, well, what would worry me in terms of cancer without any of the specific system symptoms? Those tend to be, I'm losing weight and I don't know why. I'm sweating at nighttime and I don't know why. Or I'm completely exhausted that I can't do my day-to-day activities. Those things worry us for the generics of cancer. Something could be cancer. And if any of those things happen with or without any other symptoms, if I could speak to everyone, that's what I would say I need you to come and chat to me about.
Let's talk about some of the work that you guys do in terms of reaching some of the maybe slightly more difficult to reach communities. Tell me about these multilingual animated videos.
So in Whitechapel, we look after a really large multicultural, multinational, multilingual population. The key things that we focus on when it comes to cancer screening is those who maybe are not being screened as well as they should do. This all started in a big project a couple of years ago, maybe 1 year ago, I'm losing track, on who isn't responding to their cancer screening in our population, the people that we look after here in Whitechapel. We have a large population of Bengali speakers. There's a large immigrant Bangladeshi population here, which make up a really important part of this community. What we see when we look at our data is that our Bengali speaking patients are less likely to do cancer screening. And we thought this was a bit unusual when we looked at the data of who's actually engaging with their GP. We found that those patients who were not doing their screening, perhaps because they're not understanding the language of the invite letters, were not disengaged with healthcare, but actually were up to 3 times more likely to be coming to their GP actively. So instead of being put off as, well, this is a community of people who perhaps aren't engaged with healthcare, our work focused on thinking about, well, actually, these are patients who are incredibly engaged with healthcare, more engaged with healthcare than those who are English speakers, but just the screening programs are not being received in the right way in order to pick up cancers early. The North East London Cancer Alliance has some amazing videos that teach you how to do your screening, what the screening programs involve, how the screening tests are done, and what your results might look like. I think it's that what to expect that also puts lots of people off. These videos exist in all different languages, and so we thought, well, if we know that our patients are coming to the GP really often, but they're not doing a screening, why don't we use these videos in different languages to promote that screening process to our patients that we already know are coming to see us for their healthcare? So we put these as multilingual screening videos that sit side by side in English and Bengali, and we can put them in all different languages as well, depending on your local population. We put them in our waiting rooms We have big screens in our TV screens in our waiting rooms of the GP practice. When you're sat waiting for your appointment and your GP's running 10 minutes late because someone's sick, sometimes happen. What do? You sit on your phone and we all stare at the little health messages that come up on the TV screens. At least that was the hope. And so we play these videos, try to get people engaged in the screening programs, or at least just to think about it when they're here for their GP appointment. Started here in Goodman's Fields in one site, but then we decided that this was something that was not just a population that exists locally here, but actually across all of Tower Hamlets. So as part of a big project with all of our local GP registrars or resident doctors, put this into practices across the borough. So these videos are playing in the waiting rooms. If you walk around most of the practices in Tower Hamlets, you'll see these nice videos playing, talking about cancer screening and talking about them in different languages. This ended up, I think, in 14 different GP practices across the area, engaging practices that look after hundreds of thousands of patients. And in our practice alone, we've seen over the last year, our bowel screening rate's gone up 8%, which is hundreds more people are engaged in the screening program. What that means is there's probably a few more cancers being detected early. And as I said earlier, if we're finding them early, there's a 90% chance for survival. If we're finding them late, it drops significantly.
You sort of touched on it there. Are there any other kind of big impacts, any other kind of success stories you've seen from the videos?
In terms of their reach, I think is probably the biggest thing. So, the data can show one thing, but anecdotally is really, really interesting to have a chat and to speak with other doctors across the borough who have said, actually, my patients have pointed out these videos in the waiting room and said, do I need to talk to you about bowel cancer? Do I need to talk to you? We also do them for breast cancer and cervical cancer screening, right? Do I need to talk to you about the fact that I haven't done my breast screening? I don't know how to do it. And we have those conversations often with translators, and so we can then support patients in. I think it's those little stories that are coming back from people I know that actually show the benefit of this work.
If you're hearing a story, you probably could guess that it's happened 10, 20 more times.
I'd hope.
And you haven't heard about it.
Or people just like talking to me.
Well, I mean, that's a good thing as a GP too, isn't it? You've got to be able to be someone that people want to speak to.
I hope.
Yeah, but that's a challenge because not everybody in the NHS is that good at communicating. But I guess for a GP, it's an absolutely essential skill.
Definitely. I think, talking to patients is what I do for a living. Always find it quite funny because when I was younger, I worked in a pub and I didn't really like talking to people. And I think, do you know what? I'll go and be a doctor instead. And then I turned into a doctor where all I do all day is talk to people. And actually, it's a bit like being a bartender at a pub. That everyone comes in and they tell me all their problems.
Although you can't solve it with alcohol.
That's the thing. At least now I've got some other things that I can try.
Maybe you could solve it with alcohol. Just go away, have a beer. Things might feel better.
I think as long as you're having your recommended NHS number of units, I wouldn't be able to advise more than that.
A slight change of topic. Can we talk about the HPV vaccine? Because I know this is something that you'd like to talk about. Just a quick kind of recap. What is it? Why is it so important?
Do you know what? The HPV vaccine has been a big focus for us this year. The reason being is that even more people are eligible for it, and some people are missing it. So the HPV virus is a virus that is spread throughout communities. It's a virus which anyone who is an adult who's had sex, there's about an 80% or more chance that they've been exposed to this virus at some point. Lots of people will clear this virus on their own, but in some people, this virus can cause cancers. It's the key cause of things like cervical cancers in women, but also causes things like head and neck cancers as well, which can affect men and women. We know that with the advent of HPV vaccination, we've seen across the world dramatic reductions in the rates of cervical cancers. And there is a goal across the world that if we vaccinate enough people for this virus, we could potentially eliminate cervical cancer altogether. The key thing that I want to talk about, I guess, at the moment is that when you're supposed to get your HPV vaccine, in schools, year 8 or 9, used to be girls, but now boys as well, particularly important as we're talking about men's health, are all invited to have a HPV vaccine. Lots of patients and their families will ask me questions and say, well, if this is something to do with sexual transmission, why is it something that you're giving my teenager or someone who's 12, 13 years old? And the important thing is that sex is an important part of life, whether that is as we're turning into our teenage years, into our 20s, or whether it's when we're getting married and having a family. But I want you to have the protection before that. And so vaccinating our young people is the safest thing to do. If we can vaccinate our boys and girls against HPV, we can prevent more cancers. If you miss that vaccination at school, you have until you're 25 to get that vaccine from your GP. All you need to do is walk in and ask them.
Wonderful, that easy. I mean, it's a funny thing, isn't it? Because you hear all the time people joking about, wish we had a cure for cancer. Well, here's potentially exactly that for this particular cancer or for some cancers, and yet people don't take the opportunity to get vaccinated. It's a difficult. I mean, what are the barriers to people not wanting this vaccine for themselves or for their kids?
Yeah, I think sex and the idea that things are sexually transmitted is one of the biggest things. I think, as doctors, we talk quite a lot about sex, and we acknowledge that actually in life, in lots of communities, in lots of families, it's kind of unspoken. And if there's a mention of that being relevant to something that your child's going to get at school, lots of people are put off. But as I was saying before, this is about protecting your kid for their entire life, for their future. People present with cancers as they get older. It's a disease of age, right? And so if we can protect people as young as possible with what's essentially almost cure or preventative measure for certain cancers, I would advocate that everyone should get one. The other things, I guess, that put people off are the concept of it being a vaccine, and that there's lots of worry about vaccines in communities all across the country, all across the world. I guess what we'd say is that these vaccines are extensively tested. They are tested on population levels. Millions of people have received these vaccines. And we know that the risk of side effects, the risk of complications is incredibly low, and that the benefits of being able to prevent cancers outweighs those.
Let's just circle back on the event here today. What's the purpose of it? What's going to be happening? What do you want the outcomes to be from this event?
So today, I guess we're here on World Prostate Cancer Day to talk about men's health. We've invited quite a few of our local health partners. So we have our team from the North East London Cancer Alliance, our GP team. We've got our psychologists to talk about men's mental health, which I guess is also really, really important. And another thing that we don't talk about well.
No.
We've got teams to talk about weight management. We've got teams to talk about alcohol. Interesting that we've already talked about this, right? In that we know that some men will turn to things which are not medicine, which are vices, in order to cope with things that are difficult or stressful, whether that's drinking, smoking, drugs. Those are things that when they get a little bit out of control, we want to talk to you about. The goal of today is to invite and speak to as many of our patients as possible to talk about things that they maybe didn't want to talk about before, to talk about how they can access their GP as the front door for their health, and to talk about all the other community things that exist from the NHS, from the health service, from community health to support people. The other big thing is obviously thinking about prostate cancer. Being World Prostate Cancer Day, we need to talk a little bit about prostate cancer, and I think you've got some other speakers to come and talk about prostate cancer as well. But my main thing is to think about, I want men to know the signs to watch out for and to think a little bit about their risk. We don't have a national screening program yet for prostate cancer, although it's in the news at the moment every week.
Yeah, every week it feels like, doesn't it?
But at the moment it doesn't exist.
Yeah.
And so whilst policymakers make their decisions and whilst the government decide which things they're going to endorse or not, as your family doctor, as your GP, I need you to know the things to watch out for. Now, as we get over the age of 40 or 50 in men, our prostates get bigger. Prostate, little gland, sits underneath your bladder. If it sits underneath your bladder, then those symptoms are all to do with your pee. Naturally, it gets bigger. And in some people, it gets bigger because of cancer. I don't know which ones it is, whether it's the person who doesn't have cancer or the person who does, unless you come and talk to me about it.
Yeah.
And so lots of men will say, well, my prostate's probably just getting big. That's why I'm having problems passing urine. But I don't know which patients might have prostate cancer that needs treatment, which patients might have prostate cancer that needs monitoring, or which patients just have a slightly bigger prostate because they've got older, unless you come and chat to me. I guess key symptoms are thinking about that passing of urine, those bladder problems, and the things that really annoy blokes. That's you try to pee and it doesn't start very well.
Yeah.
When you pee, the flow of urine's no good.
Yeah.
It's not like it was when you were 20. It's dribbling loads afterwards, and honestly, that can be embarrassing. And the biggest thing is that it's waking you up multiple times at night. You can't get any sleep because every few hours you're waking up to pee.
Yeah.
Those are the symptoms that, if you have them, I need you to come talk to me about your prostate. What does that involve? And then that also comes the worry, right?
Yeah.
In that lots of men, if they are educated and do know about those symptoms already, are thinking, well, I don't want to get my prostate checked. When you come to an appointment with me, we have that chat, we have that discussion, we think about some tests, so some blood tests, and I'd want you to have a PSA or a blood test to monitor your prostate if you're coming with those symptoms. But the key other thing is a prostate examination, and that's what most men are really, really terrified by. Prostate examination is your doctor with some gloves, of course, and some jelly with one finger up the bottom in order to feel your prostate, because that's how it's anatomically felt. Lots of men are terrified of this. I need you to share that worry with me when you come, right? Come anyway. If you don't want it, I can't force this upon you, but we do recommend it in people who come with symptoms. The reason being, we can do your PSA test, and your PSA test is a good marker of things like prostate cancer. And if it's raised, you might need some other tests for your prostate. But there are some cancers where the PSA might be normal, but they still have an unusual feeling prostate. What your doctor's looking for is, does it feel like cancer? It's one of the few things that we're trained to examine that could just be cancer from how we feel. What I say to most men who come for this examination because they've come with these symptoms is like you were saying earlier. I think you said it was 5 minutes of your time that is embarrassing, but means that it could be a lifetime of being well if things are investigated. What I say to most men is that it's 5 seconds. And in that 5 seconds of me examining you, we can tell you a lot more about how worried we are in terms of prostate cancer. If you don't have any symptoms, you don't need an examination. If you don't have any symptoms and you're worried about prostate cancer, you're over the age of 50, this is a chat we want to have with your GP as well. Someone in your family's had prostate cancer. If you're over the age of 50, and we know also that our black populations are at higher risk of prostate cancer as well, you can come talk to your GP about just having a simple blood test. A blood test which looks at your prostate markers. And if they're raised, then we can do some more tests. If they're low and you have no symptoms, we can reassure you. But it's that coming forwards, knowing what might happen, and being comfortable with that 5 minutes or 5 seconds of feeling uncomfortable to try to find some answers.
So, just to wrap up, how do we kind of shift the dial on this? How do we get men more able to talk about things? And if they're more able to talk about things, they're more willing to come forward and let you examine them, or even have a conversation with you about things. How do we get men, a little bit further along in this?
It's difficult, right? I think it's things like this. I think it's things like us just speaking to more men, doing things like our podcast, things like our men's health event. But I think just allowing and trying to create this discourse and this belief more within society that if you're worried about something with your health as a man, you're not going to get fobbed off by your GP. This is something where if you're worried, I want you to come and see me. If you're worried, I want you to make an appointment. your GP will always be the front door of the NHS, and I think that's the difficult bit for most people, in that what we need to do is get people to come see their GPs.
Wonderful. Toby, thank you so much for having us. Fantastic work that you're doing here. I hope this event today goes really well.
Thanks very much.
Best of luck with it, and yeah, thanks very much.
Cheers. Amazing. Thanks.